We are facing a massive hidden crisis, and it's quietly draining organizational performance all over the world. Welcome to This Explainer. Today, we're unpacking the 2025 report by the HBA think tank and Fem Technology. This thing pulls from over 1,000 respondents across 42 countries, and honestly, what it reveals completely upends how we usually think about corporate wellness. We're not just talking about some niche healthcare issue here. No, we are looking at a fundamental business blind spot, a blind spot that dramatically drains productivity, drives up operational costs, and silently pushes top talent right out the door. So if you're a business leader, an HR professional, or really just someone trying to understand the modern workforce, you need to understand exactly what's going on here.
To kick things off, we really have to shatter this illusion of a perfectly neutral healthcare system. I want you to ask yourself, what actually happens when the default medical standard is designed around a 70-kilogram male? Just think about that for a second. How does that baseline impact the entire other half of the workforce? It's a foundational question. Because you simply can't understand the financial and professional penalties that women face in the workplace until you understand the deep-rooted clinical bias they start with, literally the second they walk into a doctor's office.
Section 1. The default male body, a systemic flaw. For decades, medical training, clinical trials, and diagnostic criteria have treated men and women as medically identical, outside of the reproductive organs. Historically, women of childbearing age were actually largely excluded from early clinical trials. That means the vast majority of our medical baseline was established using only male subjects. But obviously, that approach completely ignores critical female-specific biological and hormonal realities. When you measure women's symptoms against a default norm that's rooted entirely in male-centric data, you absolutely do not get equal care. You get a system that fundamentally misunderstands how female bodies process disease, pain, and medication. We essentially built an entire medical infrastructure that treats women like they're just smaller men. And the consequences of that? Well, they're profound.
Moving to Section 2, the diagnostic gap, years in the waiting room.
So, how does that biological oversight translate into the real world? Well, it creates a staggering clinical delay. 4 years. Just let that sink in. On average, across 770 different diseases, a woman will wait 4 whole years longer than a man just to get a correct diagnosis. And it's not because they're inherently suffering from more complex mysteries. It's just that their symptoms simply don't match the textbook definitions, which, remember, were written for men. Imagine knowing something is wrong, navigating doctor after doctor, and waiting almost half a decade just to be given a name for what you're experiencing.
That delay leads to some truly staggering medical oversights. Because the baseline is male, women face a 20 to 30% higher misdiagnosis rate right across the board. Get this, if a woman is having a heart attack, she's 50% more likely to be sent home from the emergency room. Why? Because her symptoms differ from the standard male chest pressure. Researchers have even identified 86 common drugs that women metabolize much more slowly than men, which leads to a significantly higher likelihood of dangerous adverse side effects. But here's the one that really stops you in your tracks. Women's physical pain is frequently dismissed as entirely emotional or psychological. There's actually one study noted in the research that found middle-aged women presenting with real chest pain were twice as likely to be diagnosed with a mental illness than their male counterparts. Twice as likely. That's wild.
Which brings us to Section 3, the gender health tax, paying more for less.
Because of this systemic flaw, women are hit with what is literally a gender health tax. The data reveals a massive disparity just in premium spend alone. Single men in the U.S. spend about 3.9% of their income on health insurance, while single women are spending 6.8%. That is an enormous gap. And no, it's not because women are just universally more expensive to insure. It's because standard health coverage was originally designed to handle acute, catastrophic care way better than it handles the chronic, ongoing, high-maintenance conditions that disproportionately affect women. And this financial burden, it only compounds with age. Between the ages of 45 and 64, women's direct healthcare expenditures are 21% higher than men's. Think about the business impact of this. These are prime earning and leadership years, when your employees are financially stressed just to maintain a baseline of health. Paying significantly more out of pocket, it drains their disposable income and severely limits long-term retirement savings. This inequity directly feeds right back into the wider gender pay gap. You aren't just looking at personal debt here, you're looking at systemic burnout and a massive drop in retention.
Let's break down exactly where these massive out-of-pocket costs are coming from.
Basically, we're looking at invisible chronic conditions that require constant management. Endometriosis, for example, costs around $15,000 annually and affects roughly 10% of women. Pelvic floor issues, they affect 40% of women at an annual cost of $10,000. And these are often overlapping conditions, meaning many women are navigating multiple massive expenses all at once. And then there's menopause. This is not some niche, rare condition. It has a literally 100% prevalence rate. It happens to every single woman, yet these are exactly the types of conditions that are frequently excluded, minimized, or subject to crazy high deductibles in standard corporate health plans.
Next up is Section 4, the hidden workplace crisis, presenteeism and productivity. So we move from the doctor's office directly to the office desk. And the report exposes a massive workplace ROI issue here. According to the survey, 70% of women report losing between 1 to 5 days of productivity every single month due to unsupported health conditions. If you aggregate that math, you're looking at 12 to 60 days of lost productivity per year per affected employee. That is potentially 2 whole months of lost output. That equates to millions of dollars in hidden costs for companies simply because the healthcare model their benefits rely on completely fails to address their workforce's actual biological needs.
But behind that massive data set is a deeply human phenomenon known as presenteeism. The reality is many women don't actually take those 12 to 60 days off. They just push through the severe pain. They show up, they log in, but they cannot possibly perform at their peak. I mean, think about what it actually takes to just push through severe, debilitating pain at your desk simply because you're terrified of the stigma. You're physically there, but the cost to your well-being and to the company's ultimate output is just severe.
Now, 61% of women have taken time off, but an underlying culture of fear absolutely persists. Many are terrified to ask for formal help or disclose their struggles to HR. Why? Well, because they fear that speaking up will get them placed on a modern version of the mommy track. This label is incredibly damaging. It paints them as a liability, as less ambitious, or as easily distracted from their roles. This mandated silence leads directly to lost opportunities and stalled promotions, and it ultimately reinforces that wage gap we discussed earlier. And the starkest metric in this entire report, only 1 in 10 women strongly agree that their employer provides adequate resources to support their health. 1 in 10.
Let's turn to Section 5, redefining workplace support, the action plan. Okay, the good news here is that ignoring these gaps is a totally solvable problem, and employers actually have the power to fix it right now. The report provides a clear, data-driven action plan for business leaders. Step 1, centralize resources. Right now, navigating benefits is fragmented, it's complex, and honestly, it's exhausting. Bring it all into one accessible place. Step 2, redefine women's health. It's not just about maternity leave or fertility anymore. It absolutely must include chronic conditions like autoimmune diseases, endometriosis, PCOS, and menopause. And step 3, invest in listening tools. Don't just guess what your workforce needs based on outdated, male-centric models. Implement anonymous surveys, leverage employee resource groups, and proactively map your benefits to the actual human beings working for you.
Ultimately, we need to completely reframe this conversation. If you're a leader viewing women's health as a nice-to-have, niche HR perk, you are actively losing money. It is a core business driver. The organizations that step up to provide targeted, equitable support are going to be the ones that retain top talent, drastically reduce those hidden absenteeism and presenteeism costs, and drive long-term engagement. It's not just the right thing to do, it is a strategic imperative for survival in the modern market. So the final question you have to ask yourself, especially if you're in leadership, is this. The data is exceptionally clear. The financial costs are entirely undeniable. And the action plan, it's laid out right in front of you. So, are you willing to champion genuine, systemic change for your female employees, or will this just be another empty conversation? Take a hard look at your benefits and decide which side of the diagnostic gap you want your organization to stand on.